Welcome to live images. All right. Okay. 8. Just talked from my medical. I haven't done live for a while, so I'm just doing it. If you're curious, join me. Okay, so we as MM Medical, as our company, we have 4 dislocation, joint dislocation related task trainers. Okay, the first one is the finger model. I need to change the setup. All right, okay, that's better. Okay, so like I said, as I'm medical, we have 4 different task trainers to practice reduction technique. Okay, let's say you have, dislocated finger, elbow, shoulder. Usually you think you call EMS, go to the emergency room, and then you assume they know how to reduce dislocated joint. They practice. No, they are waiting for you to come so they can practice on you. And then you have to pay for it, even though you let them practice. To me, that's the problem, okay? They should be practicing, so they don't need to practice on you. So that's why I came up with this model. So this is the finger dislocating model. Finger model, okay? It's the most common finger is the middle finger. I didn't do it on purpose. That's the way it is, statistic, okay? Okay, middle finger dislocated. How you reduce it? Push and pull. If you do that, snaps. Okay, you can do practice as many as you want on this model. Okay, you can do the other way, this way too. Same thing, little extension and then traction, snaps back in. Okay, tension is adjustable. Okay, there's no risk. As a healthcare provider, you'll be scared to death when you see the first finger dislocation. You don't know what to do. No, now you can practice. Look at that. You had to push and pull, snap back in. You can practice as many you want. Okay? There you go. Okay, so this is the finger model. This is the elbow model. Okay, so the jiu-jitsu is very popular now these days, and tournament every weekend, and then people, they don't know when to stop. Elbow dislocation happen all the time. Okay, all the time. So there are a couple of different techniques to do it. So one is, let me show you here. Let me change the camera angle a little bit. So patient will be on the ground. Stretch your arm, got body weight, and then little extension, and then pull up with this arm. It's back in. Like that. Another technique could be patient will be on like a bleacher or something. Okay, hold it and pull down. You can do the same. I mean, it's hard to do right now here, so you know what? I can do it. Hold on. All right. So it's a chair, but think this is a table. Okay, and then hold it. Little extension. And a pull down. gradually, not, since this is the simulator, you can pull down fast, but you're not going to do that on actual human. You're going to pull down a little bit, it doesn't go, you put more and more, and then eventually go back in. Okay. Oh, hold up. What you doing? What am I doing, Alex? Well, I'm showing how to reduce dislocated joint without any risk on the simulator. Okay. All right. How to treat backbone? Backbone? What do you mean treat backbone? Subscribe. Thank you. Okay, so this is the elbow model again. Okay, patient facing on, let's say this is a jiu-jitsu tournament. Okay, and then your healthcare provider, and then you have to reduce dislocated elbow. Okay, this is a bleacher. Okay, bleacher, and hold it, little extension, and then pull down. Little by little, go back in. Okay, all right. So we just got two more. Okay, so we did the finger. You look like Jackie Chan. I don't think I'm not that cool, but thank you anyway. All right, so we did the finger dislocation model. Dislocate it. You had to push and pull and pull back. Okay, if you know any healthcare provider, emergency room doctor, they, as a family member, I know. I mean, okay, maybe you don't know, but they are waiting for the patient to come in to practice this. But now you don't need to. You can practice on these simulators. All right. So elbow dislocated. Okay, so it's like you're falling, you're trying to catch yourself, dislocated. So that thing I know is three different techniques. One, patients on the exam table, facing down, okay, like this so, and then you little extension and then pull down, okay, or patients on the ground, let me see. Okay, on the ground, like here, and then use your body weight and then pull up, reduce. Okay, so that's two. Okay, the one you see on the back, that's the shoulder dislocation simulator. Okay, middle finger, yes. That, hey bro, what are you doing for a living? I'm an athletic trainer. Ducky 6710. I'm a athletic trainer in the state of Texas. So middle finger, yes, it's the middle finger. That's middle finger is the most common. I'm not flicking you. This is the most common finger dislocate, the middle finger. Okay, and this is the most common joint the dislocate. So I'm not flipping you. That's the way it is. Just so. All right. Does the hand grab asking for a friend? I don't understand what you're asking. All right. So okay. Next one is the shoulder model. Okay. So this is the left shoulder model. And it's already dislocated anterior. Anterior being front to the front. Okay, that's the most common dislocation. And there are many different techniques to reduce. And which is the best, better? My honest answer, I don't know, depends. Because depends on the situation, depends on the time when you see it. Okay, so this technique I use is kind of modify Hippocratic technique. Use my hand to push. Use my hand to hold the wrist, okay? So push and pull, and also external rotation like a turn the doorknob. If you do it all together, okay? Let me see if you can see the good angle. Okay. Okay. Sorry. Okay. So watch here. If you put push and pull, external rotation, what will happen is go back in to the socket. Okay. And you can practice as many as you want. All right. Hold on. Let me get some. Does the hand grab? No. My left leg hurts in the knee area. Sometimes I have no idea, Bubba. From the pain. This stuff is way better, Dave. Stupid roadblock. I hate little bubble. Oh, I don't know what you're saying there. I'm in high school getting into sports med for, okay. I was wondering what would you do for dislocated patella. Dislocated patella is kind of simple, really. You know, it's usually the kneecap is dislocated to outside. So what you have to do is just hold the little tilt, then make it straight. It'll pop back in usually. And if that happened 2-3 times, most likely it's the surgical case. There's a ligament to hold the kneecap, and the inside it's damaged, so it needs to be reconstructed. It needs to be fixed. So usually the female athlete, but it could be happening on the male too. But yeah. Could you please repeat the shoulder? Okay, all right. So let's do the shoulder. So shoulder is the shoulder dislocation simulator. So this is the left shoulder model. Could be the opposite from your view, but so this model can recreate dislocation. So this is the dislocated to the front. Okay. Okay, this is the top. So this is the top. Okay, and then shoulders dislocated. Okay. All right. So reduction technique wise, this one is push. You're gonna push with one hand, right? Okay. Okay, and then use your right hand to hold the wrist. Okay, and so you're gonna put the opposite direction, counter traction. Okay, and then you use the hand to hold the wrist, but you also do like a turn the doorknob. Okay, external rotation. If you put all together and on like this angle, like 90 degrees right here. Okay, you put all together, not the sudden move. Just gradually you put just a little. And if you do that, go back in. Okay. And you can practice. I mean, you have to apply axial traction. Okay, you see so many, sports medicine reduction technique lecture. You go there, sit there for an hour, 2 hours, just to listen. Knowledge is important, yes, but hands-on technique practice more important than just the knowledge itself. And our task trainers are for that. You're gonna learn how you're gonna apply pressure and how fast you have to move to achieve the clunk. Okay? So, there's the last one. So I'm gonna show you this one. So what's the comment? Okay, thank you. Welcome. Okay. in the case of the shoulder, should we put from the wrist or? So, like I say, it depends on your body. You know, let's say you are strong. Any technique works for you. But if you are 100-pound healthcare provider, limited strengths, some technique is impossible. So it depends. Okay. I would go to the doctor if I have. Okay, so what is it? Alex? Yeah, Alex, George. Okay, so you assume you go to the emergency room, right? And then they practice those techniques. They don't. You just don't understand that. There's no way to practice those techniques. So they're waiting for you to come and then they practice on you and they gain clinical technique skills. And then what's going to happen is you have to pay for it, even though you let them practice. So I know the misconception. Say, well, emergency room, we go emergency. They know what to do. This case, they don't. They're waiting for you to come so they can practice on you, and you pay for, even though you let them practice. Okay, so next time if you have to go, I hope not, but if that happens, go to ask them, hey, have you practiced reduction technique? If you have not, you're gonna practice on me, you're gonna pay me. Okay? This is how it goes. So let's see, what is the another questions? I heard no. Thank you, Sped. Yeah, welcome. In the case of the shoulder, should we put the like Alex? Go to emergency room. It's the same thing. It's the same thing. You let them practice, all right? And how about structural deformity, just cervical pain? Structural deformity, I don't know anything about that part. I'm sorry. This is helpful. Thank you. Special asthma forever. I don't know. Okay. Thank you. JM 4.8. How you doing? Can you dislocate your mandible and what should you do? Oh, shoot. Hold up. I have for that. Man, I think you know exact timing. So, let me see. So, I have a prototype. Okay, so this is the TMJ temporal mandibular joint dislocation later. Okay, this is a prototype only. Okay, so here, okay, you can dislocate. It's out. We can do both. Okay, it's dislocated. So now how you can reduce? So there are a couple different ways. Usually patients, sitting down, you put the hands in like that, push down. But I learned this Japanese technique. So you go, patients on the exam table, facing up, and then you come to the head side, and then you put your hands from the top, and then push down. Can you see it? Okay, push down, and then down. So, I'm gonna develop this model. The next one is the ankle joint. So not the TMJ. I'm sorry, but yeah. Can you dislocate your mandible? Yes. how do we fix an imbalance when it comes to lifting? Imbalance, that's you need to go see physio. I am more sports medicine, acute trauma treatment. That small detail, I can say honest, I don't have the knowledge for it. So, can you dislocate your bundle? No, not the. All right. So the last one, this kind of big one. So I don't know if you can see it. This is the hip dislocation simulator. Okay, so car accident happened, right? You got car accident. You're driving, your knee hit the dashboard, body goes forward, the hip dislocate to the back, posterior. Okay. So I know you don't. If you're not a medical personnel, you don't know what it looks like, but this is the front part. This is the back side. Okay, and then it's dislocated back side. Okay. So, there's a technique called Captain Morgan technique. Okay, there's a ER drama called Pit, and the first series, episode 6, posterior hip dislocation patient comes in, and then this is how they teach at the emergency room, teaching clinic, teaching hospital. Usually pick one resident, student, doctor, and then teach the technique, because there's how you're gonna teach them. That's the only one way. Okay, and this kind of strange timing was I just debuted my model. This is a hip dislocation related to practice reduction techniques as many as you want, and that's the practice. Okay, no risk. Okay, new way to teach and learn. All right, so Captain Morgan technique wise, you put the patient's knee to 90 degrees, okay? And then you put your knee underneath, okay? And then okay? And then put the toes down, put down the toes, physics, and reduced. So, yeah, that's the technique, Captain Morgan technique. There are many other techniques for hip reduction techniques for hip, but to me, this is the smartest technique by using physics. Does it work for every case? No. Let's say this patient is 5'1", and you're a healthcare provider, you are 7'2". Your tibia is much longer than the patient's. I mean, it's not going to work. So it's not for every case, yes. But in my opinion, this is the smartest technique because it's just so easy to use. So every time I stretch my leg, my spinal cord seems, no, that's not it. Hi, can you repeat shoulder but posterior dislocation? Yes, I can do that. Oh yeah. Okay, so let me get better angle for this one. Okay, so you requested posterior dislocation. So usually anterior, right? 95%, okay? The posterior is really not common, but it happens. You can do that on my model, okay? So what do you have to do? So anterior dislocation, usual action you have to make is traction. Traction is the main thing. You have to do traction. Traction means pull. And then what I mentioned, external rotation, because of the way it is structured. Okay, because the shoulder joint is not a, like a, shoulder joint is like a golf ball and tee. Okay, it's not a good rate, but because we can move to so many directions. Okay, but structure wise, the head of this bone is not like this. It's a little offset like that. Okay, so when you dislocate, if you rotate, it will slide down easier. So anterior dislocation, you have to do external rotation. If you're a medical personnel, you understand that. So it's the posterior dislocation what you have to do. What is the answer? So posterior dislocation, you have to add, what do you have to add? Yeah, come on, somebody can answer me. Come on, come on, come on. All right, so posterior dislocation, traction with, yes, internal rotation. Thank you, thank you. You got it, you got it. So it's an internal rotation. So here, right? Push and pull with internal rotation. If you do that, go back in. Ta-da. So in my model, you really have to apply actual traction, okay? Not pretend, use so many reduction technique lecture. If you go, they will show you different kind of technique and they will match up with people and then you go, this is how you hold, this how. I mean, what do you learn, So, but mine, you have to apply actual traction, okay? Every single one of them, okay? Finger model, dorsal dislocation, you have to hold it certain way, okay? And a couple different ways. Mine is like, so the one of the technique I used to put so this the middle finger, this joint dislocated, I put my index finger underneath and use my other three fingers kind of wrap around. And my thumb on top, okay? And then pull. Again, my index finger underneath, use my other three fingers to wrap around the tip, and then pull, snap back in. As many as you want, but you have to use actual traction, not just pretend. If you don't, you just not go back in, okay? Elbow. Does it, hold on. Introduction, a twist. Does it realign the easily retraction with the shoulder? So any dislocation, they want to go back into the original space. I mean, they want to. Okay, so if you give them little traction, they want to go back into the original natural space. Yeah. But this is the thing, the longer it's out, more lymph liquid is going to fill in the space. It's going to be harder, okay? Okay, so what's the question? So what is the purpose of showing this? I am new. What is the point? So well, there is no way to practice reduction technique of dislocated joint like CPR. Nowadays it's possible. I'm an inventor. I'm trying to introduce new products. All right, speed. Okay, so I have this weird fear that when you put back to kill some nerve or flesh will be pinched between the bones. Yes, possible. So this is the thing. People scared to this. I understand where you're at. If you have let's say dislocated, elbow, okay, and then I show you just a reduction technique, but you have to, check, okay, squeeze my finger, okay, can you feel it, okay, do you have any sensation issues? If you notice, you have to note it, documentation before the reduction to protect yourself. You have to, okay, and if you don't, and then you reduce, and then later on, so they can come after you, they can sue you because you didn't mention, okay, you notice some nerve issue before the reduction, you have to document. Okay, use your phone, protect yourself. You have to protect yourself, okay, you have to do that. And then also you're let's say you're a healthcare professional, your supervisor or hospital institution, they allow you to do, you're protected because you did within the scope of practice because you're allowed to do. And you also mentioned there's a nerve damage before the reduction. However, and you didn't mention, then they come after you, you get in trouble. So you gotta protect yourself. Okay? All right. What did I just join? Did you join the class to, okay. How do I fix my right shoulder? I feel most pain when you shoulder press incline. That's, how old are you? You might have frozen shoulder syndrome. It's not. This is the to how to learn how to reduce dislocated joint. Like you got a dislocated, elbow. Okay, and you have to put it back. And as a doctor, you assume emergency room doctor, they practice these techniques. No, they don't. So they're waiting for you to come, and they practice on you, and you have to pay for it, even though you let them practice. So next time when you go to the emergency room for elbow dislocation, you gotta ask them, hey, have you done this before? You have not done it, you're gonna practice on me, you gotta pay me, because I'm gonna let you practice. Let's see how that works. I don't think it's gonna work, but okay. So this is the elbow dislocation, okay? And patients facing down on the exam table, okay? And then little extension, open it up, and then pull down gradually. And if you do that, snap back. Okay. Finger, same thing. Dislocated. Let's say you're playing basketball, trying to catch the ball, but hit the tip of your this, and dislocate like that. And then you're crying like a baby, and then you call your EMS, and you go to the emergency room, and then the doctor say, okay, let me fix it. And they're gonna fix it, like that. All right, I'm gonna send you a bill. Basically, they practice on you, okay, and then you have to pay for it. Yes, that's the problem. That's why I came up with this model to educate the healthcare providers so they can act on it right away. Let's say you come in this problem, okay, instead of waiting for the chief resident to show them how to do it, those student doctors, they can act on it right away, then you might be able to go home right away. Okay. Or paramedics on site, they can reduce it, maybe. So, all right, how do you fix my right? I told you that. Spread, it's really uncommon for joint. What do you mean? Yesterday, I rolled my ankle yesterday. Basketball, what stretch exercise should I do to get better? Keep moving, okay? Suck it up. Can you have someone sign a waiver before relocating a joint? It depends. If you are a healthcare provider working for the institution, they'll resign it. So let's say I used to work for high school setting, and any kids, they'll have to sign it to get treated. If something happened, I have a waiver. They sign it so I can treat them. But a complete stranger, different story. What is the pain in the pinky side of my wrist leading up to the side of my palm of falling injury? Ooh, sounds like you might broke this bone. Yeah, you might broke right here. You need to get an X-ray. Yeah, that hurts. Yes, that hurts pretty bad, but you need to be fixed no matter what. Okay. Hello, Pagminian. You're amazing. Thank you. Thank you. Thank you for the comment. It means a lot. That's why they have a license to practice medicine. So this is the thing. You see any doctors and they never ever say I master medicine. Okay? Because you cannot master medicine. You always practice. We practice medicine. So yes, you're right. What about the wrist? Wrist dislocation? Yes, it happens. All my model is the dislocation model without any fracture. Okay, so all the structure is integrity is still intact, and then dislocate. So yeah, daily. Oh, what is that? The daily Bible quote. Okay, no, thank you. If I had X day and they said it wasn't broken, they said they wasn't sure what was damaged. Well, I had X-ray and they say it wasn't broken. Oh, so okay, so it depends on the doctor. If they know what they're looking at. Okay, I'm not saying all the doctors are stupid. I'm not saying that, but there's a learning curve. There's a certain, if you don't know what you're looking at, you don't know. Okay, let's say this patient is very young. There's a growth plate, and there's a crack through the growth plate on X-ray. If you don't know what you're looking at, you don't know what you're looking at. You don't know. So yeah. Okay, what is it? Thumb finger? No, mine is the middle finger. Yeah. Because this finger is the most common finger. Dislocate it. Okay. So you have to push and pull. If you do that, I think you can feel a snap. That snap. The feeling you cannot practice. Well, you can practice on this model, but that's what it is. So. Okay, if someone dislocate their shoulder, how do you put it back in, and how you prevent repeated dislocation? Well, if shoulder dislocation happen, usually you want to have, somebody knows what to do. But let's say you're in the middle of nowhere, you know, let's say you're State Park, it's a different story. But it's if dislocated so many times, most likely you have to get a surgical repair to solve the problem. Yeah. There's on my YouTube channel, there's a solo technique. If you look it up, there's a solo technique called Devil's Technique. And basically let's say you have a right shoulder dislocated, okay? And then you use your good left hand to bring it to the right side, make a loop, right? And you put your right knee into the loop, okay? All right? and then push back and lean back, and then this little internal rotation. I mean, the external rotation, and then gradually, and it might work. I'm just saying. Okay. All right. All right. What's the next question? Is someone dislocated? Okay. Okay. What is the worst injury you have to deal with and now? The worst dislocation? I don't know the outcome of it, but I think I had a cervical fracture. There was a soccer tournament. There was a girl, she went up to the, trying to get the ball. Somebody just hit her leg and then, kind of swing, and then she hit her neck on the ground. And we had to call the helicopter, air med to do that. And I think that was a Thanksgiving weekend. She was coming from New York, and I don't know what happened to her, but the way it was not good. So I don't know. That's the worst one. Okay. Is it fine to crack the knuckles? The sound, it's just the air inside the joint, so it's nothing. Okay. Say hi. What is that? Bum deserve. You're so cool. Thank you. What is it? Boil ED tap. Thank you. Is it fine to crack your knuckle again? Yes, crack the knuckle is just the air in the joint. And so she should aim better. Okay, thanks. Welcome. All right. I think I'm doing good. Any requests? Anything? Hope your day is going good. I'm doing good. Thank you. Fake medical pro. Wow, haters, huh? If you're taking requests, do a flip. I don't know, what does it mean, flip? But I know a girl who slipped back in the air for one hit that. Could that dislocate a tailbone? Dislocate the tailbone? Maybe she cracked the tailbone. Yeah. Where can I buy this model? You can DM me, okay? Then I can send you the link to order that. Yeah, it's through my distributor, so yeah. And also, I mean, if the price is too much, let me know. We do workshop. It's cheaper that way. I make more money if you buy it, but it just I'm not I'm do I need to make money to do this business? Yes, but I'm not expecting to make so much money. Just I wanna introduce this product, and I wanna help people. So yeah, just send me a DM me, and then I can send you the link. And also, if you wanna talk to me for workshop, I can do that. Yeah. Suggestion to relieve some pain for some who has. I'm not specialized in those topics. I'm sorry. When I explain me for where was this Willy Polly Mini? I don't get it. If you're a hater, just don't comment. Just why you do that? How to get back to exercise? A busy person who stopped for a really long time. Uh, well, uh, I know you don't want to hear it, but don't be a bitch. Just get the gym. All right. What do you do when you get bad lower back pain at the young age? You have any idea? I'm not sure if you're too good. Well, I mean, there's many things a low back pain because your legs lengths might be not equal. Your one side hip is kind of rotated in or out. There's so many different things. Okay, so it's hard for me to say. All right, one last time. So, finger dislocation simulator, okay? You can dislocate, okay? And you have to really push and pull to achieve the snap. Tension is adjustable, so you can make it harder, okay? Next one, elbow dislocation, okay? So this is one of the techniques. So think about your jiu-jitsu tournament. Patients is on the bleacher, okay, facing down. Elbow is on the ground, on the facing to the ground, okay. Little extension and pull down. Gradually put the pressure, traction in. You can practice the technique. So when you see the actual one, you can act on it instead of, I don't know what to do. Now you can act on it. Tension is adjustable, okay? So this is the shoulder dislocation later, dislocated anterior, okay? So this technique is counter traction, traction with external rotation. Turn your hand like turn the doorknob. And if you watch here, if you do all together, go back in. Now it's back in. Okay. This is the hip dislocation simulator. Okay. Let me put the angle down a little bit. All right. So now, this is in the joint. It's supposed to be normal. But let's say you got in a car accident, okay? Think about knee hit the dashboard, body goes forward, okay, like that, and then hip dislocate like that. And when you don't have any choice, you'll be in pain anyway, but at the emergency room, this is how they put it back. Well, this is one of the techniques. I'm not saying this is the technique, but Captain Morgan technique, okay? All right, so I will put my knee underneath the patient's knee, okay? And then put basically this is the physics, and then push down the toes. What's gonna happen is, it put back in the spot. So, all right. So I get so many comments so far. Sorry. It's not being a bit too much work. So what is TCAP? I don't know. What is TCAP? I don't know what it is. What is the name of the beat? I don't know. Then why this is gonna give to? No, I don't know what is the. The finger dislocation ever happen on the lower joint in a knuckle? Yes, it happens. So this is the most common finger joint they dislocate. The middle finger, PIP joint. Yes, but it happens here. Okay, it happens also. It does. Okay. Learn how to read. And what are you talking about? That looks painful for basic injury. Can you perform alone for ourselves? I mean, it's your call if you're gonna do it. But this is the thing. Since you don't know what to do, you go to the emergency room and then you assume they know what to do. They don't. They never practice. So they're waiting for you to come there so they can practice on you. And you have to pay for it. Okay? Western. Sorry, I'm a medical. We're just trying to figure out why the hater is mad for no reason. Interesting stuff, though. Thank you. Thank you for the support. I've been doing this for a long time. There's a hater everywhere. To me, I use those comments as my fuel to go forward. To me, thank you for your energy to make a comment, check my video and make a comment about it. It's like, you must be fucking bored, you know? Don't you have better things to do? So I made their life, made their day, I guess, so, yeah. So I'm not taking it. Yeah, I know. Thank you for the support, but yeah, those haters, yeah, I get it. Like, you must be bored, like find something else to do. So, good morning, Saliman Sali. Good morning. Western Chokum Bolt. Jesus. Where are you from? I'm from I'm Japanese. I'm in Texas. Thank you so much. Final question. What is the finger is just getting on side like some left on pulled? So this model you can do only called dorsal and and then the volar. Yeah, so go on top or bottom. Okay. If the thing is on the side, like going to, I don't know how you're gonna let's do it this way, the side way, like that. Okay. Then what's gonna do is just wrap around your finger, okay, and then pull straight. Okay. Of course, you need to check if there's any fracture, but yeah. Keep going your things, brother. You got leap. Thank you. Thank you for the support. Tokyo. What the hell? You like mine? if you report ABC, he's missing. Yeah, I did. I just blocked him. Thank you. Thank you. Can you fix my foot for free? No, sorry. I can't do it for free. You gotta come to see me. Yeah, I know. What I'm just. I want to. I'm curious. I mean, I'm wasting my time to think about what is his motivation to hate somebody to make a comment like that. All right. Yeah. If somebody less flexible does it more pertinent joint is give more. No, if you have a some people has loose joint, which is it's fortunate for you and it's has less possibility you might have damage when you have dislocation. So yeah, yeah. Uh, well, that's I got enough, so I'm done. Thank you.